If you value your penis, then this video is meant for you. I'm Dr. Rena, a urologist and pelvic surgery specialist. Today we're going to discuss 10 things you should absolutely avoid doing to your penis. Gentlemen, I work as a urologist, and a big part of what I do is caring for penises. Honestly, penile health matters a lot to me, and it should matter to you as well. In this video, I'll go over 10 things you should be doing to protect your penile health that you may not have heard before. And be sure to stay until number 10, because that one will really surprise you. Now, before we jump into the video, I want to ask you for a big favor. If you've been following me for a while and watching my videos, please make sure you're subscribed to this channel. And if you are already subscribed, be sure to click the notification bell. I post content regularly on this channel, and many times it can be hard to keep up because there's always something new coming out. But I don't want you to miss important health education. I've noticed that only about 20% of you watching are actually subscribed. So please, do me this small favor. Please subscribe. If possible, share this channel with your friends as well, because spreading this message helps more people around the world get the education they deserve. Number 1 is very straightforward. Don't neglect your penis. Many of you may not be aware of this, but how your penis performs is actually a signal of your overall health. When researchers look at men who begin experiencing erection problems and follow them for about 7 years after those issues start, about 14% of them end up having a heart attack. That's why erectile dysfunction is often called the canary in the coal mine. I personally like to describe it as a health indicator, because when you have strong, healthy erections and normal desire, it says a lot about your body. First, it means you likely have good blood circulation. Your hormones are working properly. Your nervous system is functioning the way it should. It also suggests you're in a good mental and emotional place, meaning stress isn't overwhelming you. And it shows you're probably not using substances that could harm your body, especially anything that might negatively affect your penile health. Number 2, don't try do-it-yourself methods on your penis. I've truly seen just about everything, and I can tell you there is no home remedy that can safely make your penis longer or thicker. There's also no mixture or formula that will make it grow overnight, no matter what advertisements claim. I once saw an ad where someone said pouring apple cider vinegar on their penis made it grow instantly. And honestly, that doesn't even make medical sense. But I do understand that many people feel worried or desperate about penile health. Because of that, people often want quick solutions for whatever concern they have, whether it's size or erection problems. The issue is that many of these methods are unproven, unsafe, and can actually cause real damage. Let me give you a few examples. One is jelqing. Jelqing is when men use their hands and apply pressure to stretch the penis in hopes of increasing length. The problem is that this can cause tiny internal injuries or small fractures over time. That damage can eventually lead to erectile dysfunction. Any urologist will tell you, we have all treated younger men who have overdone jelqing. And guys, many of you already know this. If I advise a man to do something that could benefit his body, he usually won't do it halfway. He'll go all in. And when that happens, you can easily go too far, injure yourself, and potentially cause permanent damage to your penis. So please, avoid doing this. Another issue is men making and using homemade constriction bands. If you've seen my video about constriction bands, I talked about a case where a man put a construction nut around his penis, and we had to call the fire department to use a special saw to remove it in the emergency room. I'm completely serious. I believe he wasn't fully aware when he put it on. He passed out, and by the time he arrived at the hospital, his penis was extremely swollen. There was no way he could remove it himself. Another man cut a ring out of a plastic Coke bottle and got it stuck on his penis. It simply isn't worth the risk. You can buy a proper constriction band for around $20 online. They are much safer because they are specifically designed to be removed safely and easily. Number 3, keep it clean. Most people understand that basic hygiene is important for penile health. But for men who have a foreskin, sometimes it's easy to forget to pull it back, clean underneath, and dry that area properly. When that doesn't happen, it can lead to conditions like balanitis, which is an infection of the foreskin and can be very uncomfortable. So always take the time to gently pull the foreskin back, clean underneath, and dry the area well. If you're unable to pull your foreskin back, that's something you shouldn't ignore. While penile cancer is extremely rare, there are cases where cancer develops on the penis, and if the foreskin can't be retracted, it can be harder to notice early changes. I always tell patients to make sure they can retract their foreskin. If you can't, it's important to talk to your urologist or doctor. In some cases, this can be treated with a prescription cream, a small stretching device, or sometimes circumcision may be recommended. The goal is to be able to pull it back, clean underneath, check the area, and then return the foreskin to its normal position. Along the same lines, avoid harsh or aggressive cleaning. Some people use heavily scented or very strong soaps, which can irritate the skin. The skin of the penis is sensitive and isn't meant to be scrubbed harshly. It's best to keep it clean by letting mild soapy water run over it, making sure there is no smegma buildup, and maintaining good hygiene. But don't scrub hard or wash aggressively, because that can cause irritation, skin damage, or even small cuts. Number 4. Don't ignore pain or other warning signs. If you notice anything unusual with your penis, please speak with your doctor. Don't just hope it will go away. In some cases, it could mean you have a sexually transmitted infection. Other times, it might be a urinary tract infection. If you notice blood in your urine, it could be a sign of a kidney stone, a bladder stone, or in more serious cases, cancer. It could be bladder cancer, or even penile cancer if you notice a sore or ulcer on the penis. So please, don't ignore these signs. I know it can feel uncomfortable to see a doctor, show such a private part of your body, and talk openly about what's been happening. Some people worry they might be judged, especially if unprotected sex was involved. I completely understand that feeling. But your health is far more important. If you ever feel judged, then find another doctor who makes you feel comfortable. The main goal is to keep you safe and healthy. Some of the most difficult cases I've seen in my career were men who ignored sores or ulcers on their penis, and later discovered they had penile cancer. Penile cancer is very aggressive, even though it's extremely rare. I've only seen a small number of cases in my entire career because it's so uncommon. But when it does happen, it's very serious and emotionally difficult. Many men ignore symptoms because they're scared and don't want anything done to their penis. But the truth is, if you treat it early, you usually need much less treatment than if you wait too long. Number 5. Stay in control and stay safe. There is nothing more attractive than practicing safe sex. When you're with a partner and you're not worried about getting an STD or causing an unplanned pregnancy, you can relax completely. You can be open, comfortable, and fully present, which often leads to a much better sexual experience. So always make safety your priority. There are many ways to practice safe sex. There are also many types of condoms available, and it's important to try different ones to find what works best for you, whether it's the thinnest option or the one that feels most natural. It can also help to involve your partner in choosing. But most importantly, always stay protected. Another part of staying safe is staying in control. Why is that important? Because accidents can happen, including penile fractures. If you are having very rough or intense sex while your penis is erect and it bends suddenly, for example, if you accidentally hit the pubic bone instead of entering the vagina, or if you slip out and hit bone, you can potentially fracture your penis. This is a medical emergency. If this happens, you need to go to the emergency room right away, and surgery is usually required to repair the damage. In these cases, the outer layer of the erectile tissue, called the tunica albuginea, actually tears. This type of injury needs to be repaired. If you don't get it treated and instead try to wait it out at home, about half of men can develop erectile dysfunction over time. That's why it's much better to go to the emergency room and have it surgically repaired. Getting treatment right away gives you a much better chance of keeping normal erections instead of dealing with long-term erectile problems later. You'll usually know if a fracture has happened. Most men report hearing a popping sound, followed by intense pain and then rapid swelling of the penis, sometimes described as looking like an eggplant. It's very important to stay in control during sex. One helpful tip is to hold your partner's hips so you can better control the speed and angle of movement. This can help prevent accidents that might lead to a penile fracture and help protect your erection strength. Another thing that really helps is using lubricant. I can't stress enough how important good lubrication is. And honestly, lubricant can make sex more enjoyable. It reduces friction and makes everything smoother. Also, don't assume something is wrong with your partner if there isn't enough natural lubrication. This is a normal part of aging. Many women experience less lubrication during perimenopause and menopause. Some younger women may also have less lubrication due to medications, genetics, or other factors. It does not mean they aren't aroused. Number 6. Don't expose it to too much heat. What I mean is that your testicles need to stay in a relatively cool environment. The reason testicles are located outside the male body, while women's ovaries are inside, is because testicles require a very specific temperature to properly produce sperm. When testicles are exposed to a lot of moist heat, it can interfere with sperm production, which may lead to fertility problems and can also potentially impact testosterone levels. Because of this, it's best to limit how often you expose your testicles to things like hot tubs, jacuzzis, or steam rooms. Occasional use is usually fine, but regular or long exposure isn't ideal. Also, when you're sitting with a laptop, try to place something between the device and your lap to reduce direct heat exposure to your genitals. And when possible, keep your phone in your back pocket instead of your front pocket. Devices like laptops and phones give off heat, and over time, that heat can affect testicular health. Number 7. Be gentle with it. What do I mean by that? When you masturbate, try to avoid being overly rough or aggressive with your penis. For example, something often called death grip, which I've mentioned before. This happens when someone masturbates using very intense pressure and a very tight grip. The problem is that this level of pressure can't be matched by a vagina, mouth, or anus. It's simply not the same. When you get used to that level of intensity, your body can adapt to it. Then you may start noticing it becomes harder to get aroused or maintain an erection during sex with a partner because the sensation is very different. So, when I say be gentle, I mean try to masturbate in a way that's closer to how stimulation feels with a partner. Use lubricant and focus on enjoyment and comfort. It shouldn't feel rushed, secretive, or shame-based, like you're trying to finish as quickly as possible while hiding. Number 8. Don't smoke and take care of your overall health. Smoking can seriously damage your erections. In fact, smoking is strongly linked to erectile dysfunction, so it's best to avoid it completely. People who smoke also have a higher risk of bladder cancer. I see this regularly in my field. Bladder cancer can be especially difficult because it often requires repeated procedures using cameras inside the bladder. And in more serious cases, surgery can be major and life-changing. Your overall lifestyle has a huge impact on penile health. I know this isn't the most exciting advice. It's not fast and it's not easy, but it is extremely important. Remember earlier when I mentioned that within 7 years, about 14% of men with erectile dysfunction go on to have a heart attack? That's because erectile dysfunction is closely related to blood flow and many other aspects of your health. It can act as a warning sign or biomarker of your overall physical condition. If your body stays healthy, your erections are more likely to stay healthy too. That means eating a balanced, nutritious diet, avoiding smoking and limiting drug use, reducing alcohol intake, and staying physically active with regular exercise. Aerobic exercise and strength training are extremely important. Aerobic workouts help improve blood circulation, and resistance training helps support healthy testosterone levels. Both play a big role in your overall health, and I really can't emphasize their importance enough. Lastly, Try to manage stress as part of your lifestyle. We don't talk about this enough. Some stress is normal and even helpful. But if you are constantly stressed, it can take a serious toll on your overall health. That includes lowering your sex drive and affecting your ability to maintain erections. If you feel like you are under constant stress, it's important to look at ways you can reduce it. Think about what is within your control and what changes you can make to improve your overall quality of life. Number 9, be kind to yourself. One thing I often notice is that when men experience problems with their penis, they tend to be very hard on themselves. They worry a lot about their partner, about how their penis looks, and about how it performs. This creates a lot of stress and anxiety around intimacy, and that pressure can make the situation worse. For example, I often explain it this way. If you have trouble getting an erection one time, the next time you're with a partner, you may spend the entire time worrying about it happening again. That stress alone can make it even harder to get an erection. Then, if it happens again, the stress builds even more, and it can turn into a difficult cycle to break. So be gentle with yourself. It's normal for penile function to vary from time to time. There will be moments when things don't work perfectly, and that's okay. One occasional issue does not define your future or your health. Things often improve. But don't be overly critical of yourself or stay stuck in a constant stress loop. Many men don't talk about these worries or share their stress with anyone, and that can make things feel even heavier. And that leads us to number 10. Use it or lose it. So is there any real truth behind that old saying? In some ways, yes. What often happens is that men stop using their penis because they're no longer getting erections. They may not be having erections with a partner, and over time they pull back due to embarrassment, stress, or because their partner may also be less interested in sex. The real concern comes when erections stop altogether, including nighttime erections. Under normal conditions, men typically have 3 to 5 erections during sleep. These erections are your body's natural way of maintaining penile health by delivering well-oxygenated blood to the tissue. When those nighttime erections stop, that's when problems can start. Without regular blood flow, you may notice changes over time. The penis may seem slightly shorter, or the tissue may feel different, sometimes due to the development of scar tissue. So yes, if nighttime erections are no longer happening, it can be a sign that the penis isn't getting what it needs, and that can eventually lead to actual shrinkage. Another thing to consider is low sex drive. Often, this can be connected to stress. Other times, it may be related to hormone levels or a number of different factors. But if you start noticing that your sex drive is decreasing, or you begin avoiding sex for a long period of time, your body can slowly adjust and act like it doesn't need it anymore. As a result, your desire may continue to drop because you're no longer allowing yourself to experience that natural urge. For some people, this may not feel like a problem, but it can become an issue if you're in a relationship and your partner still wants intimacy. There are many benefits to sexual activity and emotional closeness with a partner. No matter your age or lifestyle, intimacy remains very important. It requires effort from both you and your partner. Not everyone wants sex all the time, and that's completely normal, but intimacy still holds a lot of value. And as always, remember to take care of yourself, because you truly matter.